Well, thank you, Mr. Chairman. I remember during my first term in Congress in 1989, I went to a conference put on by the American Medical Association, and the man who was then the president of the AMA was laughing in a presentation that he made about the fact that, as the ranking member mentioned, that the AMA had opposed Medicare because he said that he knew at the time it was started that the doctors would get their part, and they certainly have.
Yes.
Many doctors have gotten wealthy off of it. And I remember reading last year, I think it was an Associated Press article, that 6 of the 10 wealthiest counties in this country are suburban counties to Washington, D.C. And what I'm getting at is that, as Dr. DeBruge has mentioned, all these federal programs, they have wonderful motherhood and apple pie titles, and they have good goals, but they end up benefiting primarily government contractors, large corporations and government employees. But you mentioned Goldman Sachs and some other companies. And I noticed that CGI, the chairman mentioned that we've spent $640 million so far on the website. The Canadian company whose American subsidiary got the bulk of the money on the website, one of the top officers is a close friend to the President's family. And all of these government contracts, if you find, when you go beneath the surface and you find out what's behind it, almost all these big federal contracts are some sort of sweetheart or insider deals. I mean, I read several years ago about the revolving door at the Pentagon, because they hire all the retired admirals and generals, and then the defense contractors do. And the same thing is going to happen, I'm afraid, with Obamacare. It's going to end up benefiting some extremely big companies. I read just this morning an article that some of the health insurance companies are now working with the White House to try to implement the program because they see huge profits ahead. And I think back to the mid-90s when I went to a reception in Tennessee, and the doctor who delivered me came and brought my records, and I asked him how much he charged back then, and he said he charged $60 for 9 months of care and the delivery if they could afford it. Medical care used to be cheap and affordable, and doctors even made house calls, and then the federal government got into it. The same thing has happened. It shocked students at the University of Tennessee when I tell them that it was $90 a quarter when I went there, $270 a year, and then they started the federal student loan program. And every year since, and until that program started, college tuition and fees went up at just the rate of inflation. Then when the federal government got into it, every year since then, it's gone up 3 or 4 or 5 times the rate of inflation. And it just seems that everything the federal government subsidizes, the costs just explode. And we talk now, already we're hearing that Obamacare is going to cost 3 or 4 times more than when it was passed. And I remember reading years ago that Medicare, it was predicted, was going to cost $25 billion after it was going to cost $12 billion after the first 25 years. Instead, it cost almost 10 times that much, and now it costs 4 times more than that. And so all these federal medical programs have been lowballed on the front end. And what I don't understand is how we're going to add many millions of people who were previously uninsured, and now millions more are receiving notices saying that their premiums are going out the window so much that they're not going to be able to afford those premiums, so we're going to add all those millions. I mean, these costs, it seems to me, are inevitably going to explode. Dr. DeBruge, what do you say about that?
I mean, I agree with you. I mean, a lot of these programs, independently of the benefits, the social benefit that we assign them, are unsustainable, whether we like them or not. Medicare, Social Security, Medicaid, these are programs that are extremely expensive. And then you add on top of it the ACA, and you have we already have a big debt problem, but it's going to explode. And I wanted to add something about what you said. I mean, yes, the private insurance industry was extremely supportive because they were going to benefit immensely for it. When you have a law that mandates that everyone buys insurance, that means millions more more customers for the insurance industry. And I will bear to also say that in this instance, because of the way the law was drafted, I mean, the law did pick winner and losers, since because of the requirement by Obamacare, it meant that younger and healthier Americans were going to have to face much higher premiums.
The gentleman's time has expired. Dr. Winston, if you need to answer.
I just want to add one point just to round out what you were saying. I think it's important to keep in mind that a large source of the increase in medical expenditures is due to technological change and innovation. Obviously, we're not getting the same products that we once got.
Well, the problem
is that's a good thing, but I think the challenge and that's coming from the private sector to a large extent. The challenge for government is, how is it that they intervene in ways that spur technological change and innovation without excessive increases in costs, as opposed to impeding technological change and innovation.
Well,
that's really what we need to do.
I'll close just by saying that we're having great difficulty funding the programs that we already have.